Hi, I'm Allan Benham. I'm the Chief Operating Officer for Meadows Behavioral Healthcare. I think it's unique to us that people stay here for a long time. I've been here for 20 years, but I'm not the only one. There's people who have been here for 35 years or 40 years, their entire adult lives. When we're hiring at every level, we look for a personality fit. We look for somebody who matches what we want to bring to our patients. Very quickly, when you find somebody who matches your personality as an organization, it feels like home. And so what we do is we look for, what's your skill set and how can we utilize that best in our system and how can we promote you? And sometimes that involves additional training, sometimes that involves additional education, and sometimes it's just, hey, you know what, you're a great fit over here, let's try it over here. We're really fortunate that we have so many different career paths, whether it's in direct patient care with counseling and nurses and BHTs, or it's indirect where you're not working with the patients and you're working in the culinary department or housekeeping or marketing or admissions, or we have so many different career paths that we can find a home for anybody whose personality fits us. One of the unique things about the MBH system is our ability to take our treatment model anywhere. The Meadows started in Wickenburg and our base is here, but that doesn't stop us from going to the Meadows, Texas, to the Meadows, Malibu. And the ability to treat addictions through trauma using evidence-based treatment practices to other states. The senior fellows, they're not just pictures on the wall. They guide what we do. And my wife is a therapist. She mentions all the time, she goes, when I was in grad school, I was reading books by Dr. Carnes and by Claudia Black. Those were my textbooks, and now I get to sit next to them and work with them. It's incredible. One of the endeavors that we've launched on recently is our outpatient programming, and that includes both virtual outpatient and in-person outpatient. And that team is led by a gentleman who has 25 years building outpatient programs, and he is incredibly skilled at weaving the Meadows model through outpatient treatment for patients in both virtual and inpatient settings. And we are growing and expanding into new states to bring that access to more and more people who may not be able to make it to Arizona or to California or to Texas to attend in person. Working here, whether it's as a BHT, as a nurse, as a therapist, as an executive director, in any position, you get 45 days with your patients to see the lights come on, to see the lives change. And then you see that trickle-down effect that goes to their families and their kids and their parents and their spouses, where it starts to change generations of lives. And that is the most rewarding part of this treatment.